Monday Health Minutes, sponsored by Valley Health.
Hi, I'm Melanie Shafer. Welcome to Monday Health Minutes with Valley Health. Boy, changing your behaviors, either breaking a bad habit or starting a healthier one, can be really tough. But you know what? Therapy can help you accomplish some of those big lifestyle changes. And today we're talking about that with psychologist Kimilee Wilson. Thanks so much for being here.
Thank you for inviting me.
Yeah, so many people, I mean, who doesn't have a habit they want to change?
All do.
Yeah, we really do. So how can therapy help someone change their behaviors that can be so ingrained?
So therapy can definitely be a useful tool for someone trying to make a behavioral change. Can be helpful for a lot of different reasons, but two reasons that come to mind. One would be therapists are trained in evidence-based strategies that have research base to change the behaviors that you want to make. So you might have a friend who stopped smoking cold turkey, and so they suggest to you, hey, it worked for me, you ought to do it that way too. But therapists know that quitting cold turkey is a very ineffective technique for most. It doesn't work for very many people. So they know evidence-based strategies, behavioral counseling, medication, some combination of the two is the most effective approach for smoking cessation, for example. So the use of evidence-based strategies would be the main reason therapy could be useful. Another reason therapy can be useful when you're trying to make behavioral changes is that therapists are able to kind of help unpack some of the unhelpful beliefs and thoughts that oftentimes surround those behaviors, right? They're not behaviors in and of themselves. We oftentimes have very unhelpful thoughts and beliefs that contribute to those behaviors. So say, for example, you have a goal of improving your sleep hygiene, but you're struggling to set a regular bedtime, for example. Well, the therapist might be able to help you uncover a belief, maybe something like you should never put off until tomorrow what can be done today. That unhelpful belief might be contributing to your inability to relax prior to bedtime. So challenging that belief, establishing a more positive, healthy belief surrounding that aspect can help you make the behavioral change and to set a regular bedtime.
That's interesting. And I know a lot of people, you hear all kinds of conversations about emotional eating or stress eating. That's a big problem of mine.
Sure,
I get stressed,
a lot of it, especially in Appalachia.
Yeah, so therapy can help you maybe get to the bottom sources and like you said, have some strategies to help you stop that behavior and retract.
Absolutely. Learning why you engage in the behavior, what's contributing to it can be a key factor.
A lot of people want to change. What role does that motivation play in seeking out this kind of therapy?
A very big one. So motivation plays a huge role in making behavioral changes, so much so that there's a lot of research base that's led to the development of motivational interviewing strategies that therapists can use to kind of help gauge a patient's level of motivation and kind of help them through different stages of motivation. So there are several stages of change that have come out of this research. The first stage being the pre-contemplation stage, where the individual is not even really sure they have a problem. So if you think about the individual who says, what, me? I don't have a drinking problem. I can stop whenever I want to. They would be at that pre-contemplation stage. A couple of stages later, you have the preparation stage, where the person knows they need to make a change. They're ready to make a change. They may not know how to go about making that change. Hopefully, that's the point at which they're entering therapy, but not always.
Right.
And then one of the last stages is the maintenance phase, where the individual is actually working to sustain the behavioral changes that they've made. So motivational interviewing techniques can be very helpful, like I said, with a therapist to try to kind of work with the patient to help determine what stage are they in. Are they ready to make a change? Do we need to work here on providing some patient education about why the behaviors may be problematic and the benefits of making some of the changes? Are we in the stage where we're ready to get down to work and setting some new goals and monitoring those goals? Or have the changes been made, but we're really just looking to sustain the changes? Because even though changes can be made, the key is you have to sustain those changes over time.
Right. Some great tips. I mean, everyone has behaviors that they would rather not, but to retract that is so difficult. So this kind of behavioral change and therapy can really help you along that journey. Thank you so much, Kimilee. It was really nice chatting with you.
You as well. Thank you.
Thanks for checking in on Monday Health Minutes.